RecoverWell creates a clear path from crisis to recovery when patients need you most. RecoverWell works with patient advocates seeking higher levels of care for primary addiction, primary mental health, and eating disorders. Patient advocates are primarily healthcare professionals who work in hospitals and private practice settings. RecoverWell is also used by treatment facility case managers, social workers in crisis centers and homeless shelters, attorneys, and probation officers. As a subscriber, you will input your basic admitting criteria into the system. This is how we match patients to you: insurance accepted, level of care provided, primary diagnoses treated, mental health conditions treated, comorbidities supported, features of your facility, and modalities employed. Once your profile is verified, your contract is signed, and your invoice is paid, your account will be activated. When a patient applies to your program, your admissions team will receive a text notification alerting them that you have a new patient application. Your team can access the RecoverWell dashboard on their phone, tablet, or computer. Once they log in, they will be able to see the patient's application. They should immediately start a chat with the patient advocate by letting them know in the chat that they are reviewing the application. The first step will be to confirm that the payment method is a good match for you. Next, tell the patient what their out-of-pocket estimate is. This will require you to run a VOB and be prepared to talk dollars and cents once you get on the phone with the patient. If the insurance and treatment criteria look good, request to interview the patient. It is helpful to go into the chat and let the patient advocate know when you are available and the best way you can be reached. Once a meeting time and contact information has been exchanged, do your own intake assessment with the patient. After you speak to the patient, confirm on the platform if the patient meets criteria. This will alert the patient's advocate to create the discharge paperwork and set up transfer. If you are providing transportation for the patient, let the advocate know that in the chat. When the treating physician has cleared the patient for discharge, you will get an alert from the advocate that the patient is ready to commit. Once the patient has arrived to your facility and been admitted, let the advocate know by marking the patient as admitted. This action removes any other applications the patient may have sent to other treatment facilities. Once the patient has completed treatment, send the advocate a notification about the outcome. That's it.